Aloha everyone, and thank you for joining the COVID-19 Public Health Action webinar, Celebrating Community COVID-19 Success Stories. My name is Steph Moyer, and I'm the Community Initiatives and Training Coordinator for the Hawaii Public Health Institute. Before we get started, I just want to go over some Zoom housekeeping. For all questions, please utilize the chat box or Q&A box located at the bottom of your screen. We are not offering continuing education credits for the COVID webinar series. And lastly, all webinars will be recorded and available on the Hawaii Public Health Training Hui's YouTube channel. I am very excited to introduce you to our panel of speakers today. First, we have Olivia Pasquale. Olivia, Clinical Operations Officer with 13 years of nursing experience, moved back to her hometown of LANAI back in 2016, where she found an opportunity through LANAI Community Health Center to serve her beloved community. She enjoys being a part of LCHC's highly motivated team who have the same commitment in providing and contributing to quality patient care. In her spare time, she loves to cook, enjoys outdoor activities such as hiking and exploring Lanai's beautiful beaches, and most importantly, spending time with her loved ones. Our second speaker today is Rich Yost. Rich is the Executive Director of the Maui Food Bank. The joy of helping others is what led him to join the Maui Food Bank in March 2005. His past business experience and leadership skills have helped make the Maui Food Bank more productive, more visible, program-oriented, and focused on community needs. He is a member of the Hawaii Hunger Action Network Steering Committee, Maui Nui Food Alliance Steering Committee, a Weinberg Fellow, and a proud member of Pono Hawaii. Our third speaker today is Chauncey Hatiko. Chauncey is a community health worker supervisor with Hui Malama o Lanā Oiwi. He comes from the community that he serves and has a deep connection to Hawaii Island and understands the diverse challenges that his community faces. Tracing his lineage all the way back to the Kumulipo, he carries generational knowledge and a connection that contributes to the way that he works within the community and with the individuals that he serves. Besides being a community health worker, community advocate, and educator, he enjoys his connection to Aina and spends the majority of his time in Waipio Valley, where he tends to his taro field and enjoys the very basics of life. So without further ado, I would like to turn it over to Olivia.
Hi, everybody. Good afternoon. I'm Olivia Pasquale, Clinical Operations Officer of LANAI Community Health Center. I hope everyone's doing fine and continuing to stay healthy. Thank you for inviting me today so that I could share on behalf of LCHC our stories of how we've come together as an organization to fight off COVID. So just a background, LANAI, we're a population of a little over 3,000 people. Hasn't really changed since I graduated in 1998. I moved back, so a little over 3,000 now. And we managed to be COVID-free for almost the 8 months since that pandemic started. And so we all had such high hopes, that we would continue on with a perfect streak. But fast forward to October 20th, and our perfect streak of no COVID cases was no longer perfect. On October 20th, we had 4 confirmed cases. And so we've been fighting hard since then, to take care of our patients and our community's needs. To paint a better picture of our life here on LANAI, many of our families on LANAI live actually in multi-generational homes. So you have kupuna living with their other kids and their kids and their other, their grandkids. So very often there's more than even one family unit in one household. So you could have a minimum of 10 in one household. And also like our housing shortage here on LANAI is also a problem. That's why there's so many family units living together. So it was really important for us to educate our patients and our families about how quickly COVID-19 could spread. And internally here at LCHC, we worked really hard from the beginning to prepare for the staff, prepare the staff for the inevitable. I mean, even with our COVID, our team huddles, our associate medical director would say, like when we have COVID, not if we have COVID. Just again, it's like that mental preparation, you know. And so again, October 20 hit, and here we are. So since then, you know, it's been a whirlwind of events for our community as a whole. At LCHC alone, our staff took on additional roles on top of our current roles. Initially, clinical providers were the only ones taking care of COVID tests. You know, give or take maybe less than 3 a day, you know, before the outbreak. And then once the outbreak came, we averaged about 100 to 120 COVID tests in a day. So we needed extra help. That's when dental assistants, medical assistants, dental hygienists, RNs, and myself, we all took our turns outside in the back parking lot to, you know, conduct those COVID tests and collect swabs. Our staff, we do weekly COVID testing on our staff as well, you know, just to make sure that we can identify if there's any positive cases. The sooner the better. And, you know, for someone who's had to collect swab and actually also have to receive the swabs, it is definitely better to give than to receive, for sure. You know, the reaction to COVID in our community, it's been quite overwhelming. In a positive way. Of course, there's a lot of fear and anxiety that came along with it. But again, we really tried hard to prepare the staff early in the beginning. You know, and when the outbreak hit, many of our organizations here on LANAI, many community leaders, we all got together and made sure, you know, that we worked together to provide assistance to the patients and their families. LANAI Emergency Preparedness Crew, Straub LANAI, LANAI Kinaole, Pulama LANAI, our local police department, Maui County officials, and Department of Health. Those were the organizations we worked with. And we managed to complete 3 community test drives starting in October, on October 24th. LCHC alone conducted 529 tests on the first 2 Saturdays. And then on the 3rd Saturday, about 200 COVID testing. And that doesn't, that's not on top of our Monday through Friday COVID testing we do at LCHC. So there's been a lot of COVID swabs here on island, just from LCHC alone. So today, we do have a total of 106 positive cases here on island, but they have all been released from isolation. So that's awesome. And from those 106, 4 patients were unfortunately air-backed off island so that they could receive advanced health care. And 3 of them, great news, have already been recovered. There's 1 more patient that's still at the Maui Memorial Hospital on Maui. So prayers to our patient there. And thankfully, we have not had any positive cases since November 5. So, you know, we're hoping for the best for sure, but of course, like preparing for the worst. And, you know, as a whole, we dealt with how we were gonna continue providing healthcare, quality care, at the same time trying to protect our patients and our staff and our beloved community from this virus. Not only are we healthcare servants of our community, a lot of us are also parents dealing with Department of Education's, you know, changes. And so dealing with the distance learning on top of being a full-time parent. Oh, it's definitely been a challenging year, and I'm sure everyone can relate to that. But, you know, I think it's, despite the struggles, our staff worked really hard to comply with all of our government guidelines and follow best practices. Other measures we took to deal with COVID-19 is, since March, we set up a front porch screening assessment so that we would have no traffic in the lobby. In fact, no patient has waited in our lobby since March. The process right now is the patients wait for their appointment at the front porch and also in their cars until their appointment is ready. And so that's been working out fine for all of us. You know, and COVID-19 certainly it's caused the whole world to adapt to new changes and the new norm. I mean, I don't know about you guys, but that term new norm, that was from the beginning, like it was such a common phrase, as common as, just it's just as common as like the whole craze about the toilet paper, the new norm, and all on Instagram, social media, right? But the changes, the new norms, this included LANAI and LCHC as well. So for example, in our dental clinic, out of all the departments at LCHC, the dental team worked really hard to make the biggest adjustments, establishing new workflows to increase their safety measures. So they had to make big changes in disinfecting operatories, sterilizing equipment. They even had to establish laundry workflows so they could thoroughly clean their reusable PPEs. And if you can see on the slideshow on the top right, you can see our dental team all in their astronaut suits. That's just their headpieces, but they have the whole gown and everything when they're in patient procedures. So this is their all changes of their workflow just as a means of extra protection for the patient and also for the dental team. In the behavioral health department, telehealth services are big. We greatly depend on telehealth services via Zoom to provide therapy to our behavioral health patients. So we have 3 behavioral health specialists on board. 2 of them actually live on Oahu. So we used to fly them weekly to take care of our patient here. However, since March, they haven't flown back in, and everything for these 2 behavioral health specialists have been on telehealth meetings, Zoom meetings. And even before COVID, pre-COVID, we were actually using telehealth services a lot because of the area we live in. We want to make sure that if they don't need to travel off island, we can provide the technology that can connect them with their specialists. But since COVID hit, we definitely increased the use of telehealth services here at LCHC. As far as outreach services, LCHC connected with, with our kupuna. We called it the Kupuna Project. So it's basically an outreach service to our kupuna to help them safely social distance. So this is where the community health workers, played a big part. Community health workers, wellness coaches, and any available staff member that could assist in kupuna errands, they would go out and do it. So errands such as grocery shopping, post office runs, medication pickups and drop-offs from our dispensary or the local pharmacy. Those were things that our staff were doing for our kupuna. And, kupuna, there's some that also live alone. And so they're lonely, and they just wanted that connection, that talking story moment with the CHWs. And our CHWs, they're there and they are just on the phone even like more than 30 minutes, just talking story with the patient, just making them feel comfortable and feeling like they're not alone. And these outreach services, they're not just a task for our team. This is our way of building long-lasting relationships with our patients. And social isolation, as you all know, is a strong predictor of poor health outcomes. So we wanted to just make sure that we do our part to make sure we provide quality care in any way possible. Furthermore, CHWs, they're trained in assisting with SNAP, financial benefits, and obtaining health insurances through the marketplace. And so they help our outreach worker, Wilma, to provide these enabling services. And in this time of, COVID-19 also negatively impacting our nation economically, the LANAI is the same. Our 2 biggest employers on island, they have laid off many of their workers. And so more than ever, our patients, their family members, and other community members, we're there to help them and assist them with their enabling services. And so it's been a busy year for us. And, with LCHC having our own internal activities to fight against COVID, I did want to emphasize that many of our efforts could not have been accomplished without other caring people in our community. You know, I grew up here on Lanai, and knowing that we already had such an awesome, tight-knit community. But when tested with this COVID-19 outbreak, you can see the love and aloha we have for each other. So it was beautiful to see, beautiful. Um, on top of that, we received many donations from neighbor islands, and this includes Hawaii Pacific Health Institute, and thank you for your generous support. And even in the national level, we've received many donations for our patients, for those that aren't even patients, just the ones that are in need. And so it's just been great and beautiful to see that Lanai spirit happening even till now. Sorry. um, so I'm really proud of the way that our island has reacted and fought against COVID-19. You know, the holidays, they're going to be different for sure. But I'm just grateful in reflection time. I'm grateful for my health. I'm grateful for our LCHC Ohana and their health as well, because, you know, despite all of this, they're working hard, working through, and we're a pretty healthy bunch. Knock on wood, now I said that, huh? But it's just been amazing to be able to reflect on this time, on all the hard work that they've done. With all that's been mentioned, you know, I feel like our biggest takeaway here at LCHC was just to be flexible with the changes and just be resilient. And as the saying goes, strength comes in numbers. And with our LCHC Ohana, we definitely united and worked together to fight off and prepare against COVID-19. And like I said, it's been a challenging year, just like for all of you as well, I'm sure. But at the end of the day, we do what we can to the best of our abilities. And we just got to be proud of that. We have to be proud of the work that we do, and we do it with our hearts and with our passion. So on behalf of LANAI Community Health Center, I just wanted to thank everyone today for allowing me to share my story. Thank you to Hawaii Pacific Health Institute for giving me this opportunity to share with you guys our story. And just we're just so grateful for the assistance you have provided us. So here's my ending. Happy advanced Thanksgiving to all of you, and advance happy holidays, everyone. Stay safe and stay healthy. Thank you.
Mahalo, Olivia. Thank you so much for sharing your story with us. Next up, we have Rich. So I'd like to turn it over to you to share a little bit about the Maui Food Bank.
Hello, everyone. Good afternoon. And before I forget, happy Thanksgiving to everybody. And we are in the full swing of food bank season. Obviously, it's been like that since, you know, since beginning of April into March. Anyhow, the food bank has been going nonstop. As you might imagine, we've been doing mass food distributions. I'm going to get into the numbers here in just a minute, but every week, mass food distributions with thousands of cars lining up for miles at multiple distribution sites around Maui County. So not only you know, on the west side of Maui and central Maui and south Maui and upcountry, and but also on MOLOKAI and LANAI. Also, there's been quite a few mass distributions as well, and there's more coming. We've got major holiday distributions happening. They actually start tomorrow, and we'll go through Saturday for the folks here in Maui, and we are glad to and proud to be partners with that in those distributions. It's really put everyone to full task at trying to, in fact, get enough food in the doors and out the doors so that we can meet the demand. And again, I'll get into that, some of the numbers here in just a minute. But I wanted to just share a quick, let's see if we can do this. Hope you all can see that, but we've got Maui Food Bank. We serve the community, help the hungry. I don't have to read every slide, but basically our mission is to help the hungry Maui County by collecting and distributing food through community partnerships, and we are certainly living up to that during these times. And we serve all of Maui County, including, again, Molokai and Lanai, and we have again shipments going to the neighbor islands every month. As far as who we serve, we've got multiple agencies that partner with the Maui Food Bank. We're up to about 150 plus partnering agencies, and that's everyone from Keiki to Kapuna, people with physical disabilities, homebound. We've got, I mean, our outreach is far and wide on all the Maui County islands. And some of you may be part of some of these organizations, and the list actually goes on, but I'm not going to share the multiple pages. But that kind of gives you an idea of some of our agencies and some of our reach that the food bank does. So I wanted to kind of go into some of the poundage numbers here, and it's literally off the charts. As you can see, in purple is our 2020, and the blue is what we typically do for the same time period the prior year. So, and what you can really highlight here is the amount of purchased food, mainly due to the incredible demand that was put on us by so many people being out of work and either laid off or furloughed. And then once the stimulus funds, the $600 extra unemployment checks ran out, obviously we saw a pretty dramatic surge again in demand. But one thing that we're really proud of is trying to partner as much locally as we possibly can. So along with that purchase food number is a lot of local beef from Maui Cattle Company. Actually mass quantities of local 5-pound packages of beef that we're able to distribute at the distribution sites. And then also on the produce side of things, 90% of all that purchased produce was all purchased locally. And to give you an idea, we've purchased $662,000 of produce. And again, 90% of that money stayed here right on Maui and went straight back to the farmers. And we're extremely proud of that. We're extremely proud of the relationships with the Maui Farm Union, the Hawaii Farmers Union, the Hawaii Farm Bureau, the Maui Farm Bureau, all those folks who helped us get in touch with the farmers so that we could keep the monies here on Maui. We typically, prior to pre-COVID, we were buying from about 3 different produce vendors. And right now we're buying from about 22 produce vendors. So our distribution purchasing reach has gone far and wide to try to help as many farmers as we can to keep their fields, green and keep them, when all the hotels and the restaurants and the schools closed down, they didn't have an outlet for their food. And fortunately, we were able to have the funding to be able to buy local produce. And we were extremely grateful to be able to, again, support the Maui community in that way. And it continues on. And it's been nonstop. So let's see if we. So here, kind of give you Molokai and Lanai, some shipments. Prior year, you look at Lanai was only 12,000 pounds. This year, 55,000 pounds. And then MOLOKAI, and we really beefed up the shipments to MOLOKAI. And you can see over 300,000 pounds have been shipped just since April to our friends over on MOLOKAI and the agencies there to help alleviate some of the hunger needs there. But there we go. So total pounds. this is kind of tells the story. So if you look at April through November of 2019, not even 2 million pounds of food, but April through November of 2020, 5.6 million pounds of food. That just tells you the amount of energy and coordination and that we've had to improvise and utilize and make happen so that we can, in fact, get this food out to this community. And it's pretty alarming, the amount of container loads of food that are going out our door. This actually equates to roughly about 35,000 pounds a day, when typically the food bank does about 11,000 pounds a day. So it kind of gives you an idea in big numbers. The 5.6 million pounds is way more than we do in a total year, let alone just these months that's indicated. But it's pretty incredible. Our team has been totally awesome, totally responsive, totally adaptable. And I'm so proud of them, and I'm so proud of the community that's been helping at all these mass distributions, because they've been going nonstop for 34 weeks straight, and we could not possibly get this food out to the community without all those partnerships and those folks volunteering their time and energy to make this happen, and to ensure no one has to go without a meal. But so here you go. And so that line of cars is pretty typical of an average. That's one of the distributions on an average Thursday morning. They start lining up at 5:30 in the morning, and the actual distribution doesn't start till 8:30. That's in central Maui. The top picture on the left, that's our great folks at Lahaina Baptist that set up a distribution every week. So they've been a phenomenal force out there, and we are so proud of them and so happy that they've stepped up and making it happen. So to give you an idea, so all that food's got to be going someplace. Well, here's an idea of the number of people that we're serving. Obviously, the current November numbers aren't all in yet. We still have a week to go, and that number is going to spike highly in the last week of November, last 2 weeks here. But you look at those months in 2019, not quite 100,000 people, but you look at this year, 350,000 people we've been able to provide food for. Now, obviously, a lot of that is duplicated because people do, in fact, need to eat every day. And people actually should be eating multiple times a day. So, so people are having to go to, a distribution every week so that they can provide for their families. And then, like I spoke about, we depend on volunteers, old and young, and thousands and thousands of volunteers help us out. So there's different kinds of volunteer projects that people do, and currently we do also have the mass distribution still going on. So if any of you folks would like to volunteer, we do have a volunteer form online that you can fill out, and we certainly have some volunteer opportunities. So last year, you're looking at over 10,000 volunteers donated over 41,000 hours of their time. This year, that number is going to Probably be quadruple with the number and the amount of volunteers that are helping out at these mass distributions. It's thousands and thousands of volunteers because we couldn't do it without them. So here's a couple of quick links for each of you if you would like to help out or make a contribution to the Maui Food Bank. Here's a couple of quick links. There's the volunteer opportunity. But I wanted to give you an idea of the amount of money we're having to spend on food. You know, typically our annual budget is roughly about $500,000 for the entire year, and that includes produce purchase and container loads of food. But already in the first, just since April, we've spent $3.6 million. And that number is going to continue to escalate, especially with the amount of food that we've been purchasing for the Thanksgiving holiday. And again, you know, a big portion of that is going towards local produce, which again, and the local Maui cattle beef. So, and then the other number you don't see in this is the amount of freight that we have to pay. Fortunately, at the beginning of the COVID pandemic, we had some very generous folks over at Matson who, in fact, were able to basically fee waive some of the mainland shipments to kind of get the ball rolling, and Young Brothers helped us out at some of the inter island. Right now, we are still having to pay the full cost of a boatload to get containers here to Maui. So we are using up more of our freight monies towards that so that we can, you know, at the beginning of COVID, we were having difficulties accessing food, mainly because a lot of the manufacturers had not reconfigured their manufacturing for consumer-sized products. You know, a lot of these manufacturers were doing institutional size for schools and hospitals and restaurants and hotels and that sort of thing. So it took these manufacturers a couple months to kind of retool and then there was a shortage on cans, on the smaller cans. So trying to access food at the onset of the COVID and the shutdowns, we were having trouble. Now, the problem we're having right now accessing food is the fact that the CARES monies are running out, and everybody's trying to do, any of these food banks around the country that are getting some of this CARES funds are having to do a spend down here by, most of them by the end of the month. So we're seeing mass orders coming in, and so a number of the items that we're trying to place are in short supply. And we won't, fortunately, we did do some stocking up when the supplies were high, so we'll be able to keep providing through the holidays here. And and now with the holidays in, you know, obviously there's more demand as well put on these food suppliers. But that was about the main disruptions we had for food supplies, was the fact that the retooling for the manufacturers and finding aluminum cans to package stuff in. So, okay. I want to wish everyone a very happy Thanksgiving, and we'll continue to keep providing to this community, and we're gonna just keep at it and keep supplying what we need to do to ensure that no one goes hungry anywhere in Maui County, and we will do that with aloha and with a lot of energy. So we appreciate you all attending, and mahalo and happy holidays.
Mahalo, Rich. Thank you so much for sharing. Next, I'd like to turn it over to Chauncey.
Aloha mai kako, everyone. My name is Chauncey Hatiko, your community health worker with Hui Malama Olana'o EV. First off, I'd like to mahalo HIPHI and Stephanie Moore, my fellow panelists, Rich and Olivia, and our attendees for allowing me to be here to share with you some of the success stories within our organization. But when I think about the successes during this pandemic, it really goes farther than just our organization or a organization, but into the community and beyond. As the COVID-19 pandemic presented many challenges for individuals, communities, and organizations, it really encouraged organizations, agencies, healthcare centers, and community partners to work closer than we've ever worked before. There is no longer the mana'o that this is my kuleana and this is your kuleana, but there is now a new outlook that's been born out of the COVID-19 pandemic that this is our kuleana. And this is really the biggest success story during this COVID-19 pandemic. It is through these types of partnerships and collaborations that I'm able to share with you the success of Hui Malama Olana'o EV's Malama Ke'olo program. So as I introduce you to this program, let me take you, let me just share my screen one moment here. Awesome. So as I share with you the program called Malama Ke'ola, let me take you on a trip around Hawaii Island. The purpose of the Malama Ke'ola program was to provide for the needs of our most country and rural communities of Hawaii Island. And its goals was to uplift the physical, mental, and spiritual well-being of our families on Hawaii Island during the COVID-19 pandemic. The Malama Ke'ola distribution program was focused on addressing the needs of our communities by focusing on the complete well-being of the entire Ohana. As a healthy Ohana reproduced a healthy community, the Malama Ke'ola distribution program was designed to address the needs of all members of the Ohana, from the kupuna to the makua to the kamali'i. This program consisted of 3 components: our Malama na Ohana care packages, our Malama na kamali'i items, and Malama na kupuna collaborations. Through this distribution program, we were able to supply Ohana with basic needs, education, and resources that helped to uplift the physical, mental, and spiritual well-being of our communities by supporting our families during the COVID-19 pandemic. The first component that I'd like to speak about is our Malama na kamali'i items.
Aloha, my name is I just want to say mahalo nui to all of the people who donated to provide for our MPO distribution. Mahalo.
Our Malama na kamali'i items was a collaboration with Liliuokalani Trust and Kamehameha Schools to provide health education incentives to be distributed to Hawaii Island kamali'i that had been affected by the COVID-19 pandemic. Another component of this program I'd like to speak about is our Malama na Kupuna collaborations, where we made collaborative efforts with community partners, and we were able to provide nutritionist consultation, transportation, and staff to assist in the efforts to meet the needs of the kupuna of Hawaii Island by being part of planning and execution of numerous kupuna feeding programs here on Hawaii Island.
Thank you so much for the opportunity to be here in Puna and to open up the facility. Not just that, but also for helping and bringing your family to Kukua with us. I know if it wasn't possible without collaboration such as this. So from Hui Malama to Haas to you and your Ohana, mahalo nui for having us today.
So Lloyd, your family, your sons, Steve, Principal Haas, the board, just big mahalo nui loa for always being there for the community, always partnering with the community organizations. And I'm just blessed that you're my neighbor, and I just love you guys, and please pass our mahalos on to everybody.
Mahalo for what you guys are doing out there. And That's the true meaning of aloha. My nephew Kaika always says that. He said, we can become of service to our community. That is the true essence and the true meaning of aloha. Yeah, because we do it out of love. So I want to mahalo your guys' organization as well. You know, together, we all gonna get through this. Yeah. Aloha.
And the last component belonging to this program is our Malama na Ohana packages. And this is what you're currently observing now. This component had 3 packages that were distributed over a 3-month period. The packages consisted of our Olakino package, focused on physical well-being and safety of our Ohana during the pandemic, and our No'ono'o package, which focused on mental health, and our Ola Olakino, which focused on the spiritual well-being of the entire family. Each month, a package was introduced and distributed, and each package included items of need, education, resources, and Hui Malama information.
Deepest gratitude for allowing us to be here today, to allow us to join you and collaborate with you in regards to the good work that you guys are doing, and of course in the hopes that we can get through this pandemic and not have too much repercussions.
Through this distribution program, we were able to supply Ohana with basic needs, education, and resources that help to uplift their physical, mental, and spiritual well-being of our communities by supporting our families during this pandemic. And then not only did we serve our families, but we built relationships. Community health workers were then assigned to follow up with each candidate and each receiver, to follow up with them to see if there were any needs that were not being met and to help navigate them to the resources that they need, whether it was social services, medical care, financial needs. But this relationship built trust within the community and the organization, and the community and individuals allowed Hui Malama's community health workers to help provide them access to care and resources that were of much need during the pandemic.
Aloha, I'm Keamaloke Onuwanu. I want to go ahead and, give my aloha to the Ka'uru Health, who has been collaborating with us. So aloha, all of them, for working very diligently with us. And thank you, Auntie Jessie.
For partnering with Ka'uru Health Community Association, and they really are doing a great job for the services they provide to our community. Again, mahalo, and we look forward to continuing to work with you.
We at Hui Malama Olana'o Iwi believe that it takes an entire community, that it takes all of our organizations and healthcare centers coming together to work at once, to partner and to collaborate and blanket our communities with resources that's much needed during this pandemic. This is quite encouraging to see that our community is working closer than we've ever done and quite harmoniously during this pandemic. And it's because of these types of things that we're able to be successful in addressing the COVID-19 pandemic and taking care of the communities that we serve. Although our admin office is located in Hilo,
Aloha mai kako, o kia maluko inoa, hanau ia o ka'u. I would like to go ahead and extend my thank you to HEOC of Na'alehu, as well as the county of Hawaii for opening up this park for, and I thank you all for allowing me to go ahead and do this.
Although Hui Malama Olana'o Iwi's Administrative Office and Family Medicine Clinic is located in Hilo, our mission is to really serve the whole Hawaii island. We made it a point and made it necessary to really go into the most rural and country areas where access to social services and basic necessities would have normally not been available.
would like to say thank you to LANAI Congregational Church for having us here today. From Hui Malama Ola Na'o'iwi, we're having our program today, Malama Keola program. Thank you.
Again, from the staff here at Hui Malama Olana'o'iwi, we'd like to extend our appreciation to the Kona community for your continued support with all of our programs, including our Malama Keola program today. Mahalo. And of course, a big mahalo to all of our community members, organizations, and healthcare centers that was really implemental to being sure that this was a successful program. Awesome, and that ends my presentation, but I'd like to encourage our viewers to continue to do the good work that you are doing and express little acts of kindness with every encounter you make, because you too could be a resource for someone in need. My name is Chauncey Hatiko, your community health worker under Hui Malama Olana'o'iwi. Remember to love one another and to love yourself. Ahui ho malama pono.
Mahalo, Chauncey. Thank you so much for sharing. I want to, again, mahalo all of you for taking time for sharing your mana'o and personal experiences. COVID-19 has certainly given us the opportunity to reimagine and reset our priorities. In the spirit of Thanksgiving, I want to ask if you can share with us one lesson or piece of advice you'd like to share with our attendees today as we move forward with the new normal that awaits us. And just open it up to all of you. Whoever wants to go first can.
Awesome. So I'll share first some words of encouragement. COVID-19, we never expected it to be this long. We all pretty much prepared temporarily, but embracing the change, and enabling our communities to embrace the change, whether it's knowledge, side-by-side support, so they can be able to still attend their doctor's visits via televisit. They still can join on to our virtual workshops and classes and have these resources still available. It's here, and we are dealing with it. And the more we work together with one another to support one another, the more successful we'll be. So as words of encouragement, continue to do the things you're doing, lean upon one another, and understand that this is all of our kuleana. Thank you.
I can go next. I think this is, way back in February and March and April, all the changes. So I would always joke around like, guys, just be a flexible rubber band because it's going to change day to day. And sometimes it did. So I think that for our organization, I think like one of our saving graces was the ability to adapt to changes so quickly. Even in our small little island, there were many different changes going on. And so I think just having that openness and that mentality that you just got to go with the flow. And while COVID-19 temporarily took over those 2 or 3 weeks for us, things have kind of slowed down a lot. And so, again, never letting your guard down though, and just being prepared always for the worst, even though things are happening outside in our control. I think that just learning to be able to, like Chauncey said, just embrace the moment and just always also our mission and vision for our patients, providing that quality care and going always back to that baseline, and that root is to take care of our community, take care of our patients. And that's kind of our saving grace.
Just want to say, there's a song that keeps coming up in my head, and it's by a resident here, Mick Fleetwood and their group, Don't Stop Thinking About Tomorrow. We actually were having that conversation today, and we're talking with staff about the fact that guess what, in a few years from now, you'll be able to say, remember that whole COVID thing, and it will be hopefully a thing of the past, and it'll be just a bad memory or a great memory for some of us, and the community spirit that has come together to provide for each other and to ensure that no one in the community suffers, whether it's health or for food or whatever it happens to be. It's a community that's standing up strong, that's resilient, and I know will continue on and be better for it. I think we'll all be better for what we've all had to go through as we continue to go through it, and keep providing for this community and our our fellow citizens that are in need. And I'm just grateful to the community and to the spirit of aloha, and the fact that we are able to provide. It's very rewarding and I think humbling at the same time. So mahalo and thank you.
Thank you, everyone. So kind of keeping going with the spirit of aloha, I'm wondering if you folks want to identify a champion or organization in your communities that you would like to mahalo for their service and how they've helped you out.
Sure, I could go if that. Yeah, I really want to put a big shout out to the agencies that instantly stepped up and started doing the mass distributions. King's Cathedral in Central Maui, Lahaina Baptist Church over on the west side, Citizens Church on the west side, Kihei Baptist Church on the south side. Upcountry, a number of different organizations have stepped up. I'd like to also thank the County of Maui for stepping up and doing mass food distributions. And then all the thousands of volunteers that have worked relentlessly to keep providing for this community. Thank you.
I can go next. So like for LANAI, I think that again, strength comes in numbers. So there's so many different organizations here on island that we collaborated with so many different things, not just patient related and as far as community test drives, but also like with our outreach services. I mean, with everyone's donations. And also, Rich, thank you for the Maui Food Bank's generous support. I mean, I went, I drove to work today after lunch, and I'm not kidding you. It's 12:30, and there's a long line already. And for us on LANAI, a long line is like 4 or 5 blocks, and that was early in the beginning. So it's definitely well, that was what I saw, but apparently that was just one street, and then it goes this way. So the Maui Food Bank, the outside, for our local organizations, it's LANAI Emergency Preparedness Group. Our Pulama LANAI was a big help. LANAI Kinaole. There, the LANAI Kinaole is like a home care service, nursing organization, but they had the ins with the Pacific Islander population where the outbreak came from. And so we were able to provide for those isolated and for those that were in quarantine and give our care packages to them. And so they kind of like, were our partners in providing those care packages. Department of Health came, and even 2 doctors from the CDC in Georgia came to help educate too, and also our Maui County officials. So again, it was a combined effort from so many different places, not just on island, but also out in Maui County. So there's not just one specific organization. I think we just all came together. So thank you to everyone.
And same here, on behalf of Hui Malama Ola Na o Iwi, we really like to just thank the community and all the many organizations, from the Salvation Army to Ku'uro Health Center Association, the Department of Health, Lanakila Congregational Church, all the different community members and organizations that have really just been outpouring these blessings into the organization. That way we can go ahead and bless our communities. Thank everyone that had hands-on with all of the continued donations, even ongoing till today. Everything is much appreciated from the organization, and it's so hard to just focus a thank you to a specific organization like Olivia had mentioned, but we like to extend our mahalo to everyone out there that's continuing to support one another.
Thank you, everyone. So I think just if you want to answer maybe in 1 minute, I know, Rich, you shared about how the community can get involved and provide donations or help your organization. But if anybody else wants to share how community can help, I'll give you 1 minute to share.
Awesome. Please check us out on hmono.org. I also dropped the website in the chat box, or you feel free to email me at Chauncey, CHAUNCEY at hmono.org, and I'll be happy to facilitate any donations that may be coming our way.
Thanks, Chauncey. For LANAI Community Health Center, we're currently working on another outreach service. So on our social media platforms through Facebook and through our Instagram, LANAI Health is our Instagram name. We're reaching out to our community. If you are in need, private message us, because we do have tons of donations. I mean, our fitness room, because we're no longer doing fitness in class sessions, we turned that into a storage room full of goodies, you know, like from toilet paper, paper towel to a lot of foods. And so if anyone out there, or if you have any members here on LANAI that if you guys know of that could use the help, you know, they can also contact us here at LCHC, and we can help provide those items to them. And it's not like Oahu with the traffic, or is there traffic still? Not sure. But we're 5 minutes away from everywhere, so we can get it to them easily.
Yeah, I'd just like to say that if anyone is in need of food or knows someone who's in need of food, go to our website. We do have an active list of distribution sites. It's it's constantly being updated. So, but there is a list of the distribution sites where someone could get food assistance.
Thank you. So I do want to extend a big mahalo to Olivia, Chauncey, and Rich for being our presenters today. I want to thank all of you who joined us on Zoom. Thank you to the HIPHI staff behind the scenes helping me out. Our next Public Health Action webinar is on Wednesday, December 9th, again from 1 to 2 p.m. And our topic will cover Hawaii's budget and spending during the pandemic. On behalf of HIPHI, we want to remind you to continue practicing safe, healthy behavior to keep our loved ones safe as we move into the holiday season. Please be well, be safe, and we hope to see you on our next webinar. Aloha.